Our body undergoes several changes during puberty, and to fully understand these changes, it is first important to understand the different parts of our body. As puberty approaches, the sexual and reproductive organs of our body also undergo changes. These changes can happen in different ways in each body. External female sexual and reproductive organs. These are the external female sexual and reproductive organs. As puberty sets in, the skin around these organs start getting darker, and the process of hair growth around them also begins simultaneously. There are 3 openings in the female sexual and reproductive system. The topmost opening is the urethral opening. Urine comes out of the body through this passage. Below this is the vaginal opening. Although the vagina is inside the body, its opening is visible externally. It is from the vagina that menstrual blood flows out, a child is delivered, and sexual intercourse can also take place. The third opening is the anus, from where the body's excreta comes out, and it can also be used for sexual intercourse. The urethral and vaginal openings are covered by 2 layers of skin. The inner skin and the pinkish layer of skin is called the labia minora, and the outer thick skin is called labia majora. The 2 labia shield these openings and protect them from dirt, infections, and from any external friction. At the junction of these 2 labia and immediately above the urethral opening lies a small organ called the clitoris. A clitoris generally looks like a pea, but its size and shape can vary in different bodies. Due to the presence of sensitive nerve endings, one can experience sexual pleasure in the body when the clitoris is stroked or elated. In some individuals, the vagina is covered by a thin membrane. This is called the hymen. However, this layer is very delicate and can easily break during any physical activity like exercising or cycling. In fact, in many individuals, this layer is absent right from birth. Generally, due to lack of knowledge and information of the external female sexual and reproductive organs, it is mistaken as the vagina. All the external sexual and reproductive organs of a female, except the anal opening, are collectively known as vulva. So, can you now recognize and name all the external female sexual and reproductive organs? Internal female sexual and reproductive organs. A pair of ovaries is present inside a female's body. Can you tell when and where does the production of eggs start in the female body? In a female body, millions of premature eggs are present in the ovaries right from birth. These eggs begin to mature one by one at the onset of puberty. The ovaries are connected to the uterus with the help of fallopian tubes. The uterus is located behind the urinary bladder and is made up of several thick and flexible layers of tissues. The cervix connects the uterus to the vagina. It is important to remember that it is the uterus where the fetus develops for a period of 9 months during pregnancy, and not the stomach. Can you now recognize and name all the internal female sexual and reproductive organs? External male sexual and reproductive organs. These are external male sexual and reproductive organs. This is a flaccid penis. During puberty, the size of the penis changes. Its skin becomes darker and hair starts growing around it. The color and size of the penis also varies from person to person. This is what an erect penis looks like. The length of the penis is called the shaft. When stimulated, blood flow to the penis increases and the penis becomes erect. The upper rounded part of the penis is called the glans, at the center of which is the urethral opening. In a male body, both urine and semen come out through the passage of the urethra. There are thousands of sensitive nerve endings present in the glans, which can provide sexual pleasure when stimulated. Do you think a penis gets aroused only when a person is sexually attracted to someone? There can be many reasons for the penis to get stimulated, and it is not necessary that erection will happen only when one is sexually attracted to someone. The top part of the penis is covered with a thin layer of skin called the foreskin. This foreskin gets pulled back at the time of erection. Some people even have the foreskin removed to maintain cleanliness and to reduce the risk of infection. Below the penis, there is a sac of skin that covers the testicles. It is called the scrotum. Externally, the scrotum looks like this. Inside this sac, it is divided into two parts, with each part having a testicle. This is where the anus is situated. It is from the anus that the body's excreta comes out, and sexual intercourse can also take place. Can you now recognize and name all the external male sexual and reproductive organs? Internal male sexual and reproductive organs. The scrotum has a pair of testes. Each of these testicles starts producing millions of sperms with the onset of puberty. Sperm production is only possible at a temperature lower than that of the body temperature. Hence, testes are situated outside of the body in the scrotum. Sperms are a type of cells produced in the body that help in the process of reproduction. A long duct called the vas deferens is attached to the testicles. It carries sperms from the testicles to the urethra. The fluid released by the seminal vesicle, prostate gland, and some other glands helps nourish the sperms and also helps them swim. Can you now recognize and name all the internal male sexual and reproductive organs? Breasts. One of the changes that occur during adolescence is the development of breasts in the body. Externally, the breasts look like this. And they look like this on the inside. The deposition of fat in the breasts help to give it a shape. The mammary glands are present here. During puberty, these glands begin to develop due to the high amount of estrogen and progesterone hormones in the female body. These glands are also responsible for the production of milk after childbirth. The milk ducts present inside the breasts help carry the milk from the glands to the nipples and from where breastfeeding is done. The areola is the dark-colored skin visible from the outside that surrounds the nipple and helps in the suction of milk from the nipple during breastfeeding. So can you now correctly identify and name the different parts of the breast?